This is Shannon Vogel with Texas Medical Association. Thank you all for joining us today. When this topic was determined, it was before the COVID-19 pandemic, and much has changed in our world since then. And I know that physicians, out of dire necessity, have rushed to telemedicine, and many of you have already chosen a platform or product. And we will still go through this at a high level. I realize we cannot solve all of the payment challenges. While a lot of them are better, they're not perfect. With that, Stacy, I'll turn it back over to you to go over a few slides from the AMA. Thank you.
Thanks, Shannon. So as Shannon mentioned, the focus of today's webinar is on telehealth vendors, including best practices for evaluating, selecting, and contracting with them. It's an important part of the process in ensuring that the vendor is a partner and can support your practice. But of course, we realize that this is definitely designed to be more comprehensible and may not be feasible in the current environment as we continue to deal with COVID-19. So we'll definitely be touching on some of the recent changes to telemedicine and telehealth policy and payment. And I know Shannon and Bistan and Matt will speak to some of those changes being seen at the state level as well. But I do still think this is a very important topic, because when the dust settles, there may be some things that still need to be done in terms of vendors, given the quickness with which we are trying to make things happen now. So I think this information can still be very useful now and in the future once we kind of hopefully get past this pandemic and then ready to actually really scale telehealth in practice. So I'll walk through each of the phases of evaluating, selecting, and contracting, and to outline a few goals that we'd like to accomplish during these key points in the process. So some of those goals include researching potential vendors, considering a request for proposal process, ask for case studies and referrals, scheduling live and virtual demos of the product, choosing key metrics to be able to evaluate across vendors, negotiating terms, documenting clear and measurable definitions of success, identifying a timeline for contract and outline terms, and then finally execution of the necessary agreements that should be in place. And just for context, you see this playbook, this picture on the right side of the slide, and this is consistent with the telehealth playbook that is going to be ready to launch late next week. Everyone will receive a copy of this, and a lot of these kind of best practices that we've identified for these key pieces of the steps have really come from talking to other practices in health systems and groups that have used telemedicine and telehealth in their practices, and kind of their lessons learned in challenges and barriers that they encountered that hopefully we can fix and overcome before we even get into them, just given their experience and them sharing that with us. So let's get started with evaluating vendors, which is a crucial part of the process. But before you even get started with evaluating, you have to know, what are the key criteria that you want to even evaluate vendors on based on the needs in your practice. This will help create the likelihood of more of a long-term partner versus just maybe a pilot phase engagement. So we've developed some sample criteria and broken it out into 6 categories. Business considerations, so organizational overview. Does the company have a solid management team and financial strength? From an information technology perspective, what is their ability to integrate with your current IT equipment and workflow? What's the cost and the timeline? Do they have the necessary data elements that you need as a practice? Security, can they ensure HIPAA? Do they have liability coverage and a process for managing any potential breaches? Usability, which is very important, user experience of the technology, not only for the care team members and physicians in the practice, but also the patients that will be using this technology on the other end in their homes or wherever they may end up being. Customer service, so what level of support pre, during, and post-implementation does the telehealth vendor have or this may be even your EHR vendor that might have additional capacity or functionality to provide this service as well. And then clinical validation, maybe not quite as relevant here when evaluating the particular vendor, but do they have use cases, success stories where their technology has proven to be very useful, helpful, and worked in the way that it was intended to work in other practices. So once you have some of that key criteria developed, it's really time to kind of do that due diligence, do research on potential vendors, identify options that are available and will fit into your practice, offer a reasonable price for your practice, and also explore, like I mentioned, if you do have an existing EHR vendor that may have that functionality, and that can eliminate some of the potential additional contracting or even like red tape that you might have to go through. Consider an RFP or request for proposal process based on that criteria and get a couple of proposals from different vendors that might be a good fit. It's really important to ask for case studies and referrals. Maybe your colleagues in other practices use this technology, or asking the vendor directly for contact information to talk to another practice or group that may use this technology is always helpful, and then you can kind of get a real sense for how this works in practice. Certainly schedule live and virtual demos to see what that functionality and what their offerings are. And then this is something that we've really considered, and it's a good way to really engage your patients early on in this process, also because they will be using this technology in their homes or in their community potentially. But consider having some of your staff that maybe aren't as close to this process, and even some of the patients in your practice that are engaged patients to kind of demo and use the equipment on their own and see if they have any issues or struggles using it, because that's a good indicator that it might be too difficult for most patients from a usability perspective. So really good way just to kind of assess usability for your end users ultimately. All right, so once you've done your evaluation and have one, or maybe you have a couple still that you're deciding on, we recommend leveraging a checklist. These are some examples that we have. I know each state may have some additional things to consider, but it helps you kind of just check the pros and cons and who has what and what's most important to your practice, and really kind of put it on paper to evaluate. And this ultimately helps to ensure that you have a resource on hand in challenging situations with the vendor, support throughout the implementation process from start to finish, and potentially, hopefully, even beyond. And then just a vendor partner that's really just equally motivated to help you to achieve the success and the experience that you're looking to achieve by implementing this technology in your practice. So again, we realize that some of these are definitely steps to be taken when there's much more time to take them, but I think it's still of importance to really lay these out, and again, might be something that is reconsidered or looked back at once we kind of get through the times that we're in right now. So the final step in the process is contracting. This step has the potential to solidify a really successful long-term partnership with the chosen vendor, just by aligning expectations and goals, such as what success looks like, again, what your timeline is for implementation, and potentially scaling to other parts of the practice or the organization. Having that all laid out up front is really important, and it eliminates any misunderstandings and ultimately protects your practice and organization and the vendor as well. This is also a crucial point to be able to negotiate with the vendor beyond just maybe the financial terms. So you could explore what some additional values could be that you could get from the vendor pre and post implementation. So things like support or training or customer service support, any data analytics you might need, maybe even some project management throughout the implementation if that's something that you don't have in your practice, especially if it's a smaller practice. So based on your experience at this step with the vendor, it really can help you kind of have an idea of the type of partner that the vendor will be in the long term. So I know each state has various support resources across these important steps in the process. You'll definitely hear a lot more about those shortly, including specific to this step, even what types of agreements that you need to make sure you have in place, just again to protect your practice and your organization. So more to come from them very shortly. But as mentioned, we wanted to touch on, of course, some of the federal and state level policy and payment changes that have come up over the last couple of weeks due to COVID-19. As you probably may have heard Dr. Libby talking, this is definitely a moment for telehealth. We were a little ahead of the curve, maybe not quite enough. But I think we did have a decent amount of resources and knowledge ready to go to help to expedite this. So that's been really exciting, and I think just a testament to all of you signing up for this even before it was the topic of the day, week, what feels like a year. But I wanted to cover a few of the recent changes at the federal level that we have and know of. So to highlight, summarize, I should say, Medicare is covering telehealth for patients regardless of location, including in their homes, which was a major change, but gives physicians and practices access to be able to care for that patient population and not have them coming out into the practices in risk contracting COVID. So that's really been a wonderful change and may continue to expand as well. If physicians are licensed in multiple states, they can provide telehealth to patients in those states, so really restricting some of those licensure state-by-state restrictions that have come up, and I think, again, more changes continue to come there as well. And then a major one that is pretty specific to this vendor topic is that the HHS Office for Civil Rights announced flexibility around using technologies such as FaceTime or Skype for telehealth visits. I think, obviously, for obvious reasons, I think those are easy technologies to be able to implement and use quickly so that physicians could see their patients, so protecting them and themselves from potential exposure. So the next slide here is just a accumulation of the resources across both the state medical associations and the AMA in terms of telehealth and all things kind of COVID. So I'm sure each state will discuss some of their resources at a more detailed level. And then from an AMA perspective, I've outlined a few key resources here. So we put together a telemedicine quick guide, kind of focusing on the vendor, the workflow piece, and then payment and coding details as well. And we continue to update that and link out to various other resources that the AMA is creating. We have a Steps Forward telemedicine module that helps kind of explore what type of telemedicine is right for you. So, we mainly talk about telehealth as in the real-time audio-visual visits between a patient and a physician, but there are definitely other forms of telemedicine in terms of digital check-ins and telephone calls and store and forward imaging, things like that. So those are all kind of covered in that Steps Forward module as well. And then in collaboration with the CPT team at the AMA, we have developed, I believe it's about 10 different coding scenarios, pretty specific to COVID and telehealth, so COVID patients that are leveraging telehealth and practices that are monitoring COVID patients via telehealth, but really lays out kind of the coding process for a few different scenarios there. So it could be very helpful, especially if your practice is seeing COVID patients as well. But, I think the coding is very similar to if you were just seeing your patients normally that maybe have some chronic disease or things like that. So this is kind of a short list of our resources. Each state will probably go into more here shortly. And I am going to pass it to Shannon to talk about what Texas has to offer from a vendor perspective.
All right, thank you, Stacy. I appreciate that. And good advice, lots of good resources from the AMA. So looking at a few of the resources that TMA has, I just want to mention that all of the resources listed on our telemedicine page are open access. So anybody in any state can view and download and use these resources as appropriate. So when selecting vendors, I think the first place that you should look would be which electronic health record or EHR you're using, and look at those vendors that are integrated or have a relationship. And then if you don't see one that you like, then consider standalone vendors. TMA has compiled a list of telemedicine vendors that include standalone and EHR integrated platforms. Please know that we have not formally endorsed any telemedicine platforms. We intend to, but we have not as of yet. And all resources right now are being directed to the COVID-19 issues, so it may be a little while before we can get some endorsed. But again, those are all on our webpage at texmed.org/telemedicine. This is a sample of what our evaluation page looks like. So we tried to just at a very high level include the various vendors. We did start with those that are tied with an EHR vendor, but if you'll go to the resource and scroll down, you'll see the standalone. But we just tried to give a very brief overview, a link to their site, and also what their pricing is as reported by the vendors, just to give an idea as you compare pricing. We also have an evaluation tool designed to help physicians with some of the criteria that they may consider when selecting. Sometimes when you're buying something that you've never used before, you're uncertain of the questions to even ask or how to evaluate. So we have a pretty comprehensive tool. Not all questions will be applicable, but you could almost use it like an RFI, request for information from the vendors. And the categories include company information, because you do want to look to make sure that the company is strong, that the functionality is good, the training and support, that they will support you as needed, and of course the pricing is always important. So this will help you as you objectively compare products. So you could take the questions most important to you, ask them of a few vendors that you've narrowed it down to, and then even put that into an Excel spreadsheet and compare. And again, this is just a screenshot of what that tool looks like when you download it. It's 3 or 4 pages, but this gives you an idea of what you'll see. And then when you think about contracting with the vendors, TMA does have a free technology contract review service through the COCR group, so that is available for members. And then also, just make sure that when you do choose a vendor, you should expect to execute a business associate agreement with your chosen vendor, because they do need to be aware of their responsibility as related to HIPAA. Certainly right now, with the Office of Civil Rights relaxing the HIPAA requirements around technology, if you're using Skype or FaceTime or one of those that's not HIPAA compliant, certainly they would not have a BAA, but any other vendor that you choose for long-term use, you would expect to have a business associate agreement in place. All right, I'll now pass it over to Matt with Florida Medical Association.
All right, thanks. And thank you, Texas, for putting together so many things that definitely helped us in focusing on a few more state-specific areas. And I do encourage everybody to go over to the Texas forums. We've shared those with you all and our membership at large. There's a lot of really good stuff there. We have been working on endorsing a few as well. We'll have a few released this next week. And our first really big factor has been not to overcomplicate things when it comes to telehealth. A lot of new vendors now are trying to roll out everything in the kitchen sink into their platforms, which can even be website building tools, patient appointments, and things like that. And that can be useful to a lot of practices, but a lot of practices already have that. We're trying to help people to keep from doubling up on a lot of other things as well. Under Florida law, all you have to have to practice telehealth right now, this is before and we're assuming after the COVID-19 crisis, Telehealth visit must have video and audio, and telehealth visits must be HIPAA compliant. And as you see, many vendors bundle in a lot more than that at a lot higher price point. So really, we found you can, for a few $100s a year, you can usually find one that will work for just completing these couple of bullets. And then I also want to talk a little bit about telehealth in times of COVID-19. As was talked about earlier by Stacy, the HIPAA rules have been relaxed on the federal level. And in the last call, some people did ask us about FaceTime, Google Chat, everything like that. And right now, those are allowed. In Medicare, you will get paid for those. Now, Medicaid and private insurance, that is totally 100% still up to the plans, is our legal opinion at this time. So I would suggest using the more traditional models if you can. Obviously, some patients are not going to be open to that. They'll, especially your elderly patients or people without as much of a technology focus. But as far as the back-end payments go, you could run into some issues if you try to go outside of the normal stream of things. Our payment folks put together a great resource. Most of it's Florida-specific on the payment resources, talking about what telehealth will be paid for. A lot of your vendors can help you with this as well. A lot of the bigger ones will also have resources there. But that's pretty much what we wanted to contribute, and thank you all.
Thanks, Matt. Bisan, you are up.
This is Bisan Biari from the Massachusetts Medical Society. Thank you very much for being with us this afternoon. It's such a tough and critical time for everyone. We want to assure you that we are here for you, and we will do everything we can to help you in this difficult time. On the MMS website, in the COVID section, we have been updating many resources under the telehealth and virtual care section. We're also dedicating a phone and an email to answer your questions about telehealth. We're very thankful for this collaboration. We are co-creating many of the resources that was shared with us from the AMA and from Texas, and we will be adding the MMS information on it so you can use it for state specifics. As you're going through the process of evaluating or selecting the vendors and perhaps developing the appropriate business plan or use case and trying to make these decisions in a faster pace due to COVID, there are many things to consider, and you want to ask your vendor key questions. What is the functionality of this vendor, and what are you trying to accomplish? And what are the actions that the vendor will perform to answer your practice needs and create optimal service that you plan to render in a faster and reliable pace? And while you start to identify these vendor choices and make requirements, these requirements should be very specific to your practice setting and your practice needs. Vendors will be presenting you with demos and varieties of options, services, and like Matt said, services and boutique tailored solutions. I am sure you all remember when we were switching from paper to electronic health records, all the demos that we had to sit in through, and how many times we had to change EHRs. Your first choice may not be optimal, as mentioned. These contracts with these vendors are actually short. Some run month to month, and many offer trial periods. So you can pilot as a test run. If you're trying to get in buy-in from your partners, sometimes it's quite helpful to pilot on a small sample size and present them with the findings to ease the barriers to implementation. Overall, implementing telemedicine should be simpler than switching to an EHR, mainly because many of these companies, for example, the one that are listed on the vendor list, they have been in the business for over 15 years. So they have done this telemedicine configuration quite some time. The only difference here that the stakes are a little higher because in the EHR selection process, it was you and your team or you and the hospital. And now it's you and the patient who is involved at the forefront of the implementation. So therefore, as mentioned, another key consideration is your patient mix. Always keep in mind who is that patient who is going to be behind that smartphone or iPad. Also, as mentioned, another element to consider is your staff interaction with the technology and how your staff were engaged with patients using the technology. If you are part of a group practice, bringing together members of your team to be part of the decision-making is essential. Your practice manager, your nurse lead, your partners, all need to be involved because your selection of a particular platform will impact workflows around your practice. So it's important to consider how a particular platform or a vendor will affect the daily schedule and operations of your entire practice. Some platforms are simple and require little training and you can be up and going in an hour, and some might be a little more sophisticated. Of course, the other key question centers always around cost. You might want to do a cost analysis that can help you finalize your decision. The cost analysis can have, prices for installation, training, staff time for training, support, maintenance, user fees. You might be paying additional fees for improved bandwidth, or whether or not your EHR vendor will ask you to pay more for integration or interface. Additional things to think about when you do this analysis is to calculate reimbursement, especially now we're getting all the payment schedules for all the telehealth services or mostly what's covered. This means you have to calculate your net revenue per encounter as of now, but also because many of you here in the group are primary care doctors, so it's important to take in consideration your chronic patients, and because you are going to do some remote patient monitoring, and to understand how many missed appointments you could have rendered via telehealth in order to optimize your time. So while you're going through the process of collecting vendor information and asking questions as mentioned, it's important to create a vendor evaluation sheet to organize your thoughts on each vendor as well each platform solutions and offering. If you have not created your evaluation sheet, the AMA, also TMA has created this great vendor evaluation tool. It's available for you. And also, as you see in the screen, we put a, in the slide, we put a simple questions and brainstorming techniques for you when you're speaking to your vendors, when making your final decisions. Some of these questions can be regarding documentation on the platform, electronic referrals, lab ordering. If you're caring for family givers, can the family have access to the platform, e-prescribing, who owns the data, virtual waiting rooms, a whole variety of lists that you can think of. If you're offering group therapy, if you are doing, if there is an informed consent that they have, if you have your own informed consent and you want to send it over, any kind of encryption issues, so things in that matter. And as Stacy mentioned, you want to ask the vendor about use cases, and these use cases are also special to your practice. You probably want to ask them examples of a use case if you're doing a real-time audio-video, what are the requirements, the application for this? Or if you have a patient in your office and you want to talk to another doctor, so how can you do this patient and a physician at a distant location? Or if you're doing an e-consult, and you want to talk to another physician. So what are the applications for that also? And if they have any kind of remote monitoring services or chronic care management. I would like to mention that our Committee on Information Technology at MMS is assisting in creating a database that will have all these questions along with all the vendors that is listed on the Texas vendor list, and we are adding more vendors, and we're going to make it easy for you to select just in case if you have not selected one. For now, we are working on this. So more to come about that. Another important question you will need to address about these vendors, as Shannon has said, is how to judge whether a platform is HIPAA compliant. So before I continue, I have to give a quick disclosure. I am not administering a legal advice, and this content is purely informational. Please contact your legal counsel or attorney for more information. We are all under the impression that the waiver for the government regarding the HIPAA compliance requirement for technology will only apply during the emergency period. So at this period of time, the HIPAA and privacy rules will, after the emergency time, the HIPAA and the privacy rules, they'll probably be endorsed again. So it's a good and must to make sure that you have a BAA. The BAA, which is the Business Associate Agreement, will generally require that all covered entities and business associates enter into contracts to ensure that the business associates will appropriately safeguard protected health information. And also, one last thing I want to mention, if you're wondering if you can use your phone or your laptop or your desktop, or basically which would be the best device considered HIPAA compliant, it's really not the device. It's more the software or the platform that shows them, because basically you are granting the patient an access to this platform. So just in case, once the patient enters the secure plan, just in case if you have PHI communication or secure messages, including images or videos or documents needed to be encrypted, to make sure that they are not readable or usable when a message is intercepted over a public Wi-Fi. And you have all my email and my phone number, I hope. So if you have any questions regarding any of what we have said, there's a lot of work happening here at MMS on the advocacy side, on the payment side, on the regulation side, and thank you for being with us. And that's it for me. And I will take, I don't know if Shannon or Stacy will take the one after. Thank you.
Yep, I'll go ahead. This is Stacy. I can wrap us up. I know we have about 20 minutes left, so I want to leave plenty of time for questions. This is just a quick refresh of the upcoming events and webinars. Specifically, Thursday, April 23rd is Redesigning Your Practice. Given, I think, a bit of an expedited schedule, we may work some of that into the virtual boot camp, a mini boot camp, I should say, coming up on April 4th. But for now, we'll kind of keep these as our dates, and if anything changes, we'll definitely keep the group updated. So again, what's coming up next? We do have, still planning to have the kind of virtual mini boot camp on the 4th in the morning. This will just mainly be a place to cover some key topics relevant to right now, and hopefully what the group is going through and experiencing. And then again, just kind of leave that time to have a discussion. So we're working out what that platform might look like. It might be a little bit different than this one, just to make it hopefully a little bit more interactive. So more to come there. And then the other thing I just wanted to quickly point out here, on the last webinar, we mentioned the survey tool that we were going to leverage to kind of assess experience and measure success of this project overall. I think we're going to revisit that, given that many of you are already in the process of implementing or have implemented and are starting to use telehealth in your practice, given this expedited timeline that we've been thrown. So we'll kind of reevaluate what that looks like. I also want to be mindful of not sending out surveys for folks to be taking at this point in time. So more to come there again, but just kind of wanted to give everyone a heads up there. And then this, I'm trying to, okay, not moving on my end, but the final thing here was, here's the link to claiming the CME. We can certainly send this out again afterwards as well, but make sure that if you are eligible to claim CME for these and are participating live, that you go ahead and follow that link and claim that credit. So that is all we have. Shannon, Bisan, Matt, thank you for going over each of the particular materials and updates from the state level. And we will now take any questions in the chat box. And I'll go ahead and just read those aloud, and we'll answer them as a team. So first question, is telephone contact okay for now? We have had several people in the country without internet. That's John Hemstreet. So at least from a federal level, that seems to be something that we're not clear on, to be quite honest. But I will tell you that it's something the AMA advocacy team is strongly urging. So we're expecting some additional announcements very soon, given the recent package that is being put together, which has some additional telehealth expansion based on what I'm told. So more to come there, but I know that that's more from a Medicare perspective. So I don't know if any of the states know about any private payers that are covering telephone visits or encounters.
Dr. Hemstreet's one of ours, so I'll talk about the Florida perspective. Right now, it's not just by telephone, it's not allowed. But as of right now, they're not reimbursing for that in Florida.
This is Bisan. We are in the process of getting an alignment, hopefully by all the plans. But from what I have seen, And you will see this on under the MMS resources. We put together a guide for all the payment plans, just a reflection of what's been covered. From what I've seen, most of the commercial plans are now covering for telephone, so we're only just waiting for maybe a couple few left and anything CMS. So we have coverage for phone for the most part.
This is Shannon. So in Texas, the governor did direct the Texas Department of Insurance to issue emergency regs allowing telephone calls to count at the same rate as an in-person visit. The only issue is that applies only to state-regulated plans, which accounts for about 20% of the covered lives in Texas. So the ERISA plans, because the payers simply are the administrator, not the designer of the plans, they don't have the authority to make those plans cover telemedicine. In fact, some of them have telemedicine coverage, but they instruct their employees to use a certain vendor, such as a direct-to-consumer vendor, and they may cover it 100%. But one thing I've heard, I was in a conversation with one of the plan representatives earlier this week, and she indicated that MD Live and some of those other direct-to-consumer ones, that patients are experiencing approximately a 2 to 3 hour wait to be seen. So interesting times there as far as what's covered. I know on the Medicare side, Stacey mentioned that AMA is heavily advocating for higher payment. They do have the virtual check-in that allows a telephone, but it's a very low reimbursement rate. I think I understand it to be around $14 or so.
Thanks, all. I think more to come there then. We'll definitely continually update our resources and push that out to this group as well as we continue to get updates. Next question, could we see new patients in the clinic or nursing homes via telemedicine? So my understanding, based on how our advocacy team has interpreted some of the federal level changes, is that CMS will not enforce a requirement that patients have an established relationship. So, I think from a federal perspective and at least a Medicare perspective, that seems to be a yes, but I don't know if there are different rules at the state level, so I will also defer to my colleagues.
Oh, sorry. Go ahead, Shannon.
Okay, I'll just say real quickly, for Texas, it's a yes. You may see new patients. Go ahead, Bisam.
In Massachusetts, it's yes. The board has waived it.
All right. So the next three questions in the list here are all related to vendor recommendations. So I will, on behalf of the AMA, I'll speak to the fact that we actually do not recommend or endorse vendors. We've provided lists via other groups that have created them. We actually are in frequent contact with the American Telemedicine Association as well, and they should be launching a list of vendors pretty soon. But again, I know at the state level, Shannon and Bisan especially, and I think Matt as well mentioned, they're all kind of putting together lists of I guess we'll say preferred vendors, or at least vendors that they've done some research on. So I will defer to them as well on that one.
I would say for Texas physicians that are part of our cohort, if you're having a hard time deciding even from the list, because I know it's quite a few that are on the list, please feel free to reach out to me. I'll gladly have a conversation and help talk through with you some goals and ideas of how you may want to proceed.
Same for Massachusetts. We don't have an endorsement as of now. And if there's anything that we can help with, I know some of the physicians in our group had already been reaching out, and we've been connecting them with the right folks as well. So we will do everything we can, but as of now, there's no endorsement.
Yeah, and we agree with both the other states. Just give us a call. We'll kind of run through your needs with you and help you figure out which one best meets those needs.
Great. I think that's a great approach. And we also had another one here about their telehealth platform through their EHR carryout. It fails often and has no support. So again, you heard the state recommendations, and also just the fact that they will be putting out, or if they haven't already, putting out some lists. But I will also say, I do think just the insane influx of need for telehealth software has come unexpectedly to many vendors, and we've heard that a lot from various physicians and practices, and usually about pretty well-respected vendors in the space. So I kind of also wonder if it's just a pure bandwidth issue as well right now, that I'm not sure we can completely solve to, if that makes sense.
Yeah.
But definitely, I think reach out to your state and talk through what some options are, some different options.
I would agree with that. Stacey, can I just add something?
Sorry.
If I can just add something
Absolutely.
real quickly. This is Shannon. When I was speaking, I mentioned about checking your EHR vendor first. And, certainly while that's not a bad way to go just to see what they have, and if you like it, it might make things easier. But I would say that don't feel limited at all, because you would still typically document within your EHR regardless of what platform you use. There's really no reason to keep PHI or a lot of information in your telemedicine platform. So for simplicity's sake, document within your EHR, but use whatever platform you like. And on that note, one thing I failed to mention, I did not hear anybody else, a great idea to have two dual screens if you don't already. Get that second screen. It's not expensive to buy a second monitor and to have the coaxial or the whatever you need to have that bifurcated to where you can see both screens, and you can document on one and be looking at the patient on the other.
And then there was another question about Texas and the ability to see new patients through telemedicine. Is that for COVID-19 or generally for new patients? And I'll just speak to at the federal level, the expansions have been for COVID and other, like all patients can access telehealth services. But Shannon, I don't know if that's any different in Texas.
Yeah, in Texas, during our 2017 session, Senate Bill 1107 did remove the requirement that you have an in-person visit first before establishing a relationship with the patient. So even without COVID, physicians can see a patient. We do have the licensure issue, though. It must be a Texas resident. I know that there's been some relaxation across state lines, but Texas Medical Board still does require that to see a Texas resident, you do have to be licensed in Texas.
Okay, so Dr. Libby's saying, I think it's really important for doctors to evaluate the whole package of needs as you've identified. Many are rushing in without much perspective and are not getting the quality of technology they really need. How are we going to help docs make good choices in the short term? I think that is a good question, and a bit difficult in these times where everyone, like you said, was rushing to make some decisions and get things implemented very quickly. I personally still think it's very important to do some of that due diligence that we talked about today. So while it does take some time, I think it will help in the long term to make sure that you have a platform that is strong and is meeting the needs of the practice. I don't know if any of my state colleagues have anything to add there. I think I've unmuted you all again.
This is go ahead.
Some that we've talked to actually allow for shorter-term agreements. So if you just want to get something for the next month, say, some of the more basic ones, you can do that. It's just to get up and running, and then long-term, look at other options.
This is Bisan, and of course, I'm not endorsing anything or I'm making any points about anybody, but just in case, if your practice, especially the numbers are going higher and higher every day, and say that you have to close, or God forbid, if you or any of your key staff members got sick and you went home and you want to utilize the things that are in the waivers for a very short time, your Skype or your FaceTime or whatever it is that follows in those lines, you can start there, but don't make it as a long run. Maybe just as a quick and upgoing thing, but then as Stacey mentioned, do the work to get a reliable source because we don't know how long this will last, and also we don't know post-COVID how things will turn after as well. We might just end up using telehealth as a mean, as of what we all had wished for, previously. So that's just my thoughts of everything I have seen, with all the physicians that we've been talking to.
This is Shannon, and I totally agree, especially what Matt said on the short-term contracts. I think it gives you a nice chance to test the waters a little bit, see what features you like and don't like. And I think Bisan made this point earlier during her presentation about the patient side. See what your patients are accepting and able to use, because the technology has got to be very simple on the patient side. But I would agree, test the waters and then start to shop for what really makes sense for the long run.
All right, and we did have one more question that came up. How is the physical exam facilitated in telemedicine? A good question. I'm going to defer, I think, if Shannon, I know Bisan, you had started to create some great resources around how to kind of conduct a telemedicine visit. And I think that's definitely something on our radar to create more comprehensive resources around as part of this initiative especially.
One thing that I'll say, Dr. Alozi, one of our members, he did a podcast with me earlier this week that is now posted on our telemedicine page. And it's only 15 or 16 minutes. It's a very brief podcast. But he does go into that a little bit about the physicality of it and the exam over telemedicine. And he's been using telemedicine for about 3 years. So he just gives some very practical advice about the evaluation. So I would encourage y'all to take a listen to that. It's not, again, restricted to TMA members, so any of you on the call may access that and listen to it. And if you have any trouble finding it, let me know, and I'll get the link to you.
And I have the link for the podcast now, so I can email it to the group as well.
Oh, good. Thank you.
Thank you, Shannon.
Awesome.
And yes, one of our physicians are going to be engaged of creating some tip sheets and probably recording, a quick video about, best practices in regarding of how you practice medicine virtually. So that should be coming very soon, hopefully.
Perfect. I think, Dr. Libby, I was able to unmute you if you wanted to share any additional insights there as well.
Can you hear me now, or?
Yes.
Oh, you can. Great.
Sorry. Yeah, absolutely. Sorry. It was just the muffling behind when you unmuted everyone was a little interrupting, so had to do it on an individual basis. So sorry about that.
No problem. So when we look at COVID, it's basically infected the internet. It's infected every entity out there, and the listservs are just buzzing with people experimenting, trying to figure out how, and really pushing themselves into territory that they're really not familiar with, and using the most practical and first suggestion that comes up on a listserv that says, I did this and it worked out pretty well yesterday, but not really having any of the perspective. And I really appreciate the depth and breadth of the evaluation forms that you guys have put forth. It's really, it's important to be able to put that, just wait a minute before you get too deep into it, make sure you know what you're going to need, because once you start to develop these relationships with patients who have to register on portals or go through some platform and put their information into it, and you develop a history and a record with that particular platform, it's hard to get them to change. So it is really important, I think, for us to find a way to get this information out through medical organizations, through any vehicles that we have, to be able to distribute and say, just take a breath and make sure you're getting what you need, not just today, but tomorrow as well, because this will be a part of your practice. I keep emphasizing it however I can, but you guys have a much, much, much bigger reach than I do. So it's a really, it's a crucial issue.
Yeah, agree. Thanks, Dr. Libby. All right. Yeah, we got a comment also the way technology has failed us throughout the call. I think that was more of a non-muting issue that was happening. So hopefully we can I'll have to know everyone's number that we need to make sure is able to talk over the speaker next time ahead of time. Or just have everyone mute themselves. So we will try harder to enforce that next time, but definitely understand that there are some challenges in rural areas with bandwidth and elderly elderly population in terms of using technology, especially when it fails. So I think this actually is also a testament to continuing our efforts, especially now, to make sure that we can get telephone calls covered as well. As you mentioned, having to kind of finish some of those calls on the phone. So more to come there, and I think given the current situation is really shedding light on the importance of telehealth, and I think it will also, for better or worse, shine some light on the challenges that come about when implementing telehealth and telemedicine, which I think rural areas, bandwidth, those things are going to continue to come up. So all key things that we'll be able to hopefully collect and advocate for in the future based on these experiences we're having now. So. Okay, I think we are past time, so I want to be really cognizant of everyone's time, and we thank you for joining us today. Again, if there are any additional questions after the fact, feel free to reach out to any and all of us, and then we will look forward to talking with you all on Saturday, April 4th as well. Any of my colleagues have anything to add?
Stacey, do you want to mention the conversation, the discussion post that Meg had on the AMA, on the Education Network?
Yeah. So the community, the telehealth initiative community, is a sub-community within a broader community, as I'm sure many of you are aware if you've logged in, called the Physician Innovation Network. And we have launched a virtual discussion there as well, started Monday. We've identified some experts in telemedicine. Shannon's participating, Dr. Libby's participating, but really looking at this as a place for anyone that has questions about how to quickly, efficiently, effectively, safely implement telemedicine in practice. Can go there and ask questions. So even some of the vendor questions are, I think that's a great space to ask some of those, so you can hear from other folks that maybe are having successes with other types of vendors. But that is a discussion that's ongoing, and we just kind of put it up there as a resource until we feel that it's no longer needed. But so far, in a matter of just 3.5 or so days, we've had over 16,000 views. A really engaged group of people coming and interacting and answering questions and sharing their experiences. So that's definitely another resource or space to try to leverage the knowledge of the crowd, if you will. All right. Well, thank you all. We'll wrap it up today, and we will talk to you very soon.